Dr. Beck, let's talk about, you do lots of physical therapy and all those things. Many times we think that you go to a physical therapist after you have physically hurt yourself, and then you get back to safe. But what about the slow, stuff happening? And let's just say, and I know I speak for lots of people, and thanks God I didn't have it yet, but there's lots of people who tell me they simply have hip pain, and frankly they even have it when sleeping, when being laying in bed. It feels like they want to kind of like lift the hip, not being pressured by the bed. Does is there anything specific about it? Anything you can help with?
Yeah, I think hip pain is a really good example of conditions that develop slowly over a period of time. One of the most common conditions I see with regards to hip pain is bursitis. And the bursitis is really there's a sac of connective tissue over the lateral or outside aspects of your hip. This is where that pointy hip bone is, and you can reach down and feel that. And what happens is people tell me, gosh, when I roll on my side at night, it just kills me. I can't stand it. I have to get up. I have to move around. And what happens is that people over time, particularly if you're not very active and don't stretch, you get really tight tendons over the top of this bursal sac that's on the side of your hip. And those tight tendons just constantly rub across that sac, and it causes it to be irritated. And so it can be very painful, and just about any activity you do can be really aggravated by this condition. But the good news is it's a very treatable condition. And the way we treat that is with several different modalities. For example, we now use ultrasound-guided injections where I can actually look inside that hip sac and place my needle directly into the sac and inject steroids and really do a great job of alleviating the pain. But that's only part of the story. The other part is fixing the problem, and that is the tight tendons going over that bursal sac. And in this case, this is where you need physical therapy and therapeutic exercise. And this is, again, where modalities such as heat and cold can be really helpful. But fixing that tight tissue is really the ultimate problem that you've got to address. Other modalities we can use are anti-inflammatories and pain medications. But again, getting the immediate symptoms under control is one thing we can do with the injections and medication. But to really fix the problem, we have to get after those tight tendons that's causing the problem in the first place. And this is something that may have taken several years to develop and get you in a place where you need help. And at the same time, we're not going to fix several years' worth of problems, in overnight. So this is going to be probably a 2 to 3 month period of rehabilitation and diligent exercise on the part of the patient to get this thing doing better.
What about if a person doesn't fix it with rehabilitation, with physical therapy, and with the things you explained? Will it get so bad that the person then starts going under the knife and starts having hip replacement, or what's the deal? Or does everybody know one has nothing to do with the other one?
Well, it won't result in a hip replacement because that's really a problem with the hip joint. But if it does not respond to what we call conservative measures, that means things short of surgery, then we often do refer to an orthopedic surgeon, ask them to look at the patient and see if surgery is an option. And there are procedures that can address this where they actually take that sac out of the hip joint to help decrease the pain.
Okay. So it's a problem. It's something which comes up, but it can be fixed.
Yeah, in most cases, it responds very nicely to, again, more conservative or less non-surgical type treatments.
And if not, there's still the surgical one, but one doesn't have to live with pain for the rest of their life.
That's correct.
Okay. Great to know. Great to know.